Ja, herzlich willkommen zu einer neuen Ausgabe ASI Talk und ich hole jetzt das Interview nach, das ich letzte Woche nicht machen habe können. Das ist das Interview, das natürlich am meisten erwartet wird und ich habe einen Conflict of Interest. Ich bin Aktionär. Howard, thank you to have time, and I must say it in the introduction first. I have a conflict of interest. I'm a shareholder. I was also part of the last private placement. I think the placement before, and I bought stock also on the market. So for me, is Sirona one of my biggest investment what I have. So far, I'm not really happy when I look at the share price at the moment. We have a little bit room of improvement. By the share price, and one reason why we have a little bit room of improvements by the share price is for sure the 1067. I think the process to get a partner with 1067 is now it takes a little bit longer than the most people expect. So how maybe you can fill us in how the process looks now and what you expect from your point at the moment.
Yeah. Yeah, well, I understand your disappointment with the share price and the current progress. We in management also share your disappointment, and this definitely does reflect the lack of an announced completed transaction licensing agreement for TFC 1067. And we were a strong belief based upon what we were told with a potential partner that at this point in time, we would have completed a definitive agreement and would have announced the transaction. However, that partner unexpectedly went through a reorganization, a restructuring, and this was not related to our partnering of TFC 1067. This was a global change within the company. There was a refocus of their energies and staff resources, and unfortunately we got caught up in that restructuring. The company, the branch of the company we were talking to had 5 licensing project negotiations underway. All of them got halted. Mm-hmm. Now that we were able to meet up with senior management, including the CEO recently at JP Morgan Health Conference in San Francisco, we were able to, also introduce them to some new technology, and we're hoping to re-engage them in discussions. At the time the discussions were halted, we had all the important terms of the license agreement negotiated, including the milestone payments. All the numbers were in place, but unfortunately, right before the beginning of the definitive agreement process with the lawyers, the project was unfortunately halted. However, they are still very interested in the science and the opportunity, and we're hoping to re-engage them. And
is it you have also the alternative about that you have another skin liner product that was former used by Valiant now, then they sold this to a Chinese group, I think, when you write
yes.
Is there any possibility that maybe they join this 1067 or yeah?
So what we have decided is that we were very confident we would have a transaction. However, things change that are outside our control. So we have hired a former Allergan BD expert, Kevin Green, who has years of experience in BD transactions, particularly in this space of these cosmeceuticals. We've refocused all our energy to license TFC 1067, but we are no longer focused just on one company.
Okay.
So we are talking to multiple companies, and that process is well underway. It started before we attended JP Morgan Health Conference, and it went in full earnest during JP Morgan Health Conferences. We have over a dozen companies that we are actively in conversation with, and that includes Obagi Medical Products. We had the licensing agreement with. They, however, correctly, it has decided not to further develop TFC 849 because of challenges in synthetic process. The synthetic process proved to be difficult. We have overcome those challenges with TFC 1067. It's a three-step process. It's easy to scale up. It has a low cost of goods, and it has an excellent overall profile. We have now 7 compounds in our skin lightening library. 3 of them are definitely have enormous potential for commercialization due to the synthetic process. TFC 849 and several others have a long synthetic process, and the cost of goods makes it not practical to commercialize. However, the 7 compounds enable us to protect the whole area from competition, from people coming up with derivatives of our.
From the patent side, it's very important to have this 849.
849 is still important if it protects the patent space. We protect the whole family of skin lighteners that we have generated. But definitely we have the opportunity to develop supplements. TFC 10.
Okay, to summarize means the process is now you are more focused not only of one company, you're looking for a different one. So the process is now really open, and you have that's still in process, and we can expect it that some in the future you coming up with a deal for this 1067, and you start this process before the GP Health conference. So that's
yeah, we realize, yeah, the whole process has been taking far too long, and our potential partner was moving very slowly. We already realize that we need to have a back.
So okay, this was 1067, but today you're coming up with very important news. I'm not really a guy who understands it really, but what I understand it looks good that you have a breakthrough against wrinkles and so on. And wrinkles is very important. I need it for me at least in 2-3 years. This was the news from today, and I think 2 days ago you're coming up with the news that one bank pays the $500,000. Also very important, and is a big commitment for the process going forward with this project. But first, maybe you can introduce us a little bit to the news from today.
Yeah, so we've come up with breakthrough technology, which looks very promising to treat the wrinkles. So this is another cosmeceutical agent. The anti-aging market is anticipated to grow to $330 billion by 2021. Currently, the anti-wrinkle market is massive. The Botox market has been estimated to be currently over $3 billion US in annual sales. So we've discovered a new compound which acts on a cellular level. It works upon appears to work upon the fibroblasts. It causes the fibroblasts to increase their lipid synthesis and to plump up, converting to adipocytes. Adipocytes are the fat storage cells. This works not deep in the subcutaneous layers of the skin, but in the dermal layers of the skin. So the fibroblasts thicken up and create a plumping effect. Thereby, we believe this could be a potential reversal of wrinkles. It also has a preservation effect on the fibroblasts, and also encourage their proliferation. So this is a breakthrough treatment which would be topical. So unlike Botox, which is an injection and is actually requires intervention, this would be a topical application for treatment of anti-wrinkles, which is breakthrough. And there are other limitations. Botox basically treats the wrinkles in the forehead, and they call them the frown lines, or the glabellar lines. So there's a limited application of Botox, although very effective in that area. It's limited application. Whereas our compound would be able to work on other areas of the facial skin or elsewhere.
And Botox is not really healthy in general.
Well, Botox is a neurotoxin. Although generally well tolerated. There is definitely safety concerns, and there is potential adverse side effects, which, when they occur, can be quite serious. And it's a neurotoxin which you're injecting into your body. And it doesn't actually, it only causes paralysis of the muscles. So whereas we're hoping that our new compound will actually act on a cellular level and actually reverse on the cellular level the actual aging of the skin, which is the loss of the fat tissue and the loss of the fibroblasts, which maintain the structure. So we're able actually to restore that loss of the fat tissue and restore fibroblasts, which are normally lost through the aging process. So truly anti-wrinkle effects. So this is definitely breakthrough technology.
I must really say I have not too much clue what you're telling me, but it sounds great. And I must believe you that this is really a breakthrough. But how are we going forward with this project? So what you're planning?
So we're developing a proof of concept clinical trial. So our goal is to complete safety tests so we can enter into an actual clinical trial to show proof of concept.
But this is, for my understanding, if it's really working, a better or bigger market than the skin lighter, or?
They're both massive markets, and there's both unmet needs. So I mean, if you're looking for the anti-wrinkle, you're looking at either Botox or you're looking at injection of fillers. There's really not an ideal form of treatment. So you have unmet needs, you have massive markets. The skin lightening market is massive in Asia. The anti-wrinkle market is massive globally.
Yeah.
Yes.
Okay. So it looks like that you are running on different stories. You have the skin lighter of the one hand, you have this anti-wrinkle on the other hand, but you have also this thing with the one bank. How it looks there? What is the next steps per them? And I know exactly. I think one bank have only the right for China, and you have the rest of the world. So you can. How it looks like here?
So Bang is filed for an IND studies, which is the permission to do a human clinical testing. We anticipate approval in the near term. Never know exactly how long it will be, but we're optimistic that could be within the next month. That will trigger another payment, so $500,000 US. And with the actual performance of the clinical trial, we will have access to that data. Further support development. We would be optimistic that then have this may bring interest into other global players.
Okay, we have a little bit problem with the sound. So when I understand you right, they are working on clinical tests. When that's working the next few months through, then the next milestone payments are you achieve the next milestones, and you get a next milestone payments about $500,000. And all the data are you can show to other people, and they are potential partners for the rest of the world. Is this right, or was the right summary?
Yeah.
Okay.
Yeah, the actual payment will be paid prior to the actual start of the clinical trial. It's the approval. So
yeah.
That's good. And then there'll be further milestones down the road, and the milestones increase significantly in the amount of money.
Okay.
So.
Okay. For my better understanding, if everything running fine, when you think really a final product out of this one joint venture is coming up?
Oh, well, we're going to, as far as when it's going to finally be commercialized, we're going to need to touch bases again with the team at Huabang and find the next clinical development. You're still several years down the road to get before you're going to end up with a final product. But there are very substantial milestones which we anticipate they will reach. And ultimately, a licensed product will have ongoing royalty payments. So these, although the $500,000 US is very substantial, since we are still really just in a pre-revenue stage, the future milestones are becoming very significant. So this is becoming a very significant success for the company. Also, having a compound in clinical trial, in human clinical trial, is a major milestone and proof of the power of the platform that we have developed.
I have some questions from subscribers. One asked me about the acne component, when this ready for partnering.
Well, we synthesized the acne compound. We need to do some preclinical proof of concept testing. We are temporarily holding back that process because our lab is focused more on our anti-wrinkle and anti-aging compounds. However, that project there's a lot of work has been done. We actually have compounds that are ready for testing, and we temporarily put a hold on that project, and hope to restart it shortly.
Yeah, here's another question is the management team willing to buy shares at the open market to show trust in the company?
Well, in the last private placement, which the company performed, I invested $150,000 personally, and it's a fairly substantial sum of money. I typically don't buy shares on the open market, but I have to be careful because I'm a party to information which may not be disclosed, so I have to be very careful about that, but I may do so.
Okay, and the last question from this group is what you are planning to expand your investor base. You need new investors new investors increase your share price.
Yeah, we are looking at other ways we can bring in new shareholders. We understand that in a public market you need to constantly doing work to keep the shareholders informed and to bring new shareholders informed about the company. And so currently we started engaging a firm out of Denmark which has a large group of investors which they interact with mainly through Facebook, and we've recently engaged that group to tell them the story of Sirona.
Okay. To summarize for my viewers, so 1067, you are not focused any longer on one partner, you're looking for other ones. The discussion is now running since a few months. You started this process a few months ago. You hire a special guy who is specialized in this kind of transaction. You coming up with a new product is for anti-wrinkle. That's you say it's a breakthrough, and you're working now on this to bring up a new studies on it. So then it's a very important point. Then with One Bang, you reach a milestone. You get payment of 500,000 from them. New milestone payments going higher when the process is going forward. That's very substantially for the company. You have other products like this acne compounding and so on in plans, but at the moment you are more focused on this anti-wrinkle system or component. And you are working on the investor base. I think you're on my side when you say nobody is happy with the share price at the moment. But with the news flow, positive news flow, hopefully the share price will lift up. Is this a good summary?
I think so, yes.
Perfect. I think then we come to the end of our interview. We should have it always compact. Thank you, Howard, for your time. Und jetzt nochmal kurze Zusammenfassung. 1067, der Skinleiter. Sie sind jetzt nicht mehr fokussiert auf einen Player, der hat ein Restrukturierungsprogramm durchlaufen und ist jetzt nicht mehr, also hat alle Lizenzierungsprogramme auf Hold gestellt, nicht nur das von Sirona, sondern alle anderen auch. Sie schauen daher und sprechen daher mit einer breiten Masse von interessierten Unternehmen. Sie haben sich einen Spezialisten geholt, der für diese Transaktionen zuständig ist und spezialisiert ist auf diese Transaktionen. Ein Durchbruch, sogenannter Breakthrough, ist passiert bei diesen Anti-Wrinkle. Das sind sozusagen diese Fältchen, die wir haben rund um die Augen, im Gesicht und sonst irgendwo, weil es eben im Verhältnis, er hat eben gesagt, Botox ist ein Eingriff, das wird aufgetragen. Sie haben einen effektiven Effekt auf die Falten, auf die Faltentiefe, und er sagt, das ist eigentlich ein Major-Durchbruch also Major Breakthrough in diesem Bereich. One Bang, sehr wichtig, Milestone Payment von 500.000 ist gezahlt worden, haben sie vor ein paar Tagen gemeldet. Er sagt, der Prozess, bis das ein kommerzielles Produkt ist, wird noch Jahre dauern, aber die Milestone-Zahlungen gehen dann jetzt dramatisch nach oben, und dadurch wird das ein wichtiger, extrem wichtiger Teil der Sirona-Familie sein. Es waren dann noch Fragen bezüglich Akne-Produkte. Akne haben sie momentan ein bisschen zurückgestellt, weil es einfach der Durchbruch bei diesem Faltenprodukt da war, und das wollen sie jetzt einfach vorwärts treiben. Akne-Produkte sind ready zum Testen, allerdings noch nicht ganz, also ist von der Priorität nach hinten gestellt. Management-Team kauft eher im Private Placement, nicht eher am offenen Markt, und sie arbeiten natürlich an der Investorenbasis, weil man braucht neue Investoren, um den Aktienkurs nach oben zu treiben. Interessantes Update, natürlich nicht das ungefähr, was wir uns natürlich erhofft haben. Es wäre natürlich uns viel lieber gewesen, wir hätten jetzt die Sektkorken aufmachen können und der Deal wäre da. Allerdings, gut Ding braucht Weile, und bei Sirona sind wir ja mittlerweile jetzt gewohnt. Thank you to have time, thank you, and good luck with your new product, and good luck also with hope the potential deal of 1067. I'm looking forward for what's happened in the future. Next time when I come over to Vancouver, I hope it's in May or June. Hope you have time for a new interview in person, and then I can look also in your new office building where you are now you're based. And thank you for your time, and good luck.
Thank you.